Welcome. Thank you guys all for joining us today, taking time during your lunch hour to visit us at our virtual Wenatchee Valley Museum Community Forum. Today's Community Forum, we're discussing business reopening. The goal today is to provide the business community with a platform for discussion on reopening in a safe manner. I'm your moderator today. My name is Mariah Thornock. I'm the Director of Operations here at the museum. And over the past couple of weeks, we've been crowdsourcing questions related to business reopening. I know that this is a big topic here at the museum that we've been struggling with, wanting to make sure that we're providing a safe and healthy environment. We can't wait until the community can come back through our doors. We miss all of our visitors. We certainly missed all of our school tours that we had this summer, or that we normally have this summer. But we want to make sure that we're doing that in a healthy way. I'm assuming that if I've had a lot of questions about that and how to get us going, there's a lot of questions out there in the business community as well. If you're joining us on Facebook Live, please feel free to leave any of questions that you might have in the comment section. We do have staff members that are monitoring those questions and are going to be feeding those to the panel here. If you've been able to join us on Zoom, we do have a Q&A section and a comment section. If you're at your desktop, it's at the bottom of the screen. If you're on a mobile device, it's at the top. Please leave your comments and questions there, and we'll get to them, as many of them as we can today. But I'd like to take an opportunity to introduce the panel that we have today. We're joined by a great panel. First with us is Dr. Greg Ledgerwood. Dr. Ledgerwood is a physician. He's been practicing in North Central Washington for the past 40 years, specializing in allergy, asthma, and COPD. He currently is lecturing to medical providers nationally on chronic respiratory disease treatment. And locally, he's been working with business leaders like Blair McCaney over at Works on reopening protocols to minimize COVID-19 exposure in his facility. Also on board today is Sasha Sleiman. Sasha joined the Wenatchee Valley Chamber of Commerce in March, just as the governor declared a state of emergency. So really got to hit the ground running. Sasha's role at the chamber is with government affairs. She's been the chamber point person during the pandemic, supporting local businesses, and sees the chamber as a champion for our community's quality of life and economic vitality, and doing this through collaborative leadership and sound business advocacy. And finally, today we also have with us a fixture of our historic downtown, Linda Hagelin. Linda has been, for the past 9 years, has been leading a small nonprofit called the Wenatchee Downtown Association. Linda and her team cheerlead small businesses in our historic downtown and lead economic development efforts. Linda is a Wenatchee Valley native, and in her own words, from birth, my life has been in a place that I love so much. Wouldn't that be great for all of us to be able to say? So I want to thank you all for joining us today. We're going to spend the next hour discussing how, as a community, we can reopen our businesses, how we can do that in a safe way and in a practical way, what guidelines are out there, how to understand those guidelines, and hopefully at the end just to develop a sense of community and know that there are resources out there for all of us. But I thought first I'd give everybody a chance to say a quick hello so you get to see their faces. Greg, Dr. Ledgerwood, let's start with you.
Yeah, well, thank you very much for inviting me in this panel this afternoon, and look forward to questions that I may not have covered in when I discuss what I want to discuss. How's that?
Sounds great. And Sasha and Linda are joining us today from the chamber. They're all masked up, and I'm going to give them a chance to say hello.
Good. Hi, everyone. I'm Sasha. It's so nice to be here and so lovely to actually be in person with Linda. We've got our masks, like you can see, and hopefully you guys can all hear us okay. I did want to really briefly, and we can get to it as we discuss, but thank both Chelan and Douglas counties. They are who provided these masks that Linda and I are wearing. And Linda and our teams here at the Chamber and the Downtown Association have been distributing these to businesses across the counties with the help of the counties. So huge thank you to those, and we're happy to wear them.
And I'm Linda, and yes, this is my home, and I'm in my downtown, which is my happy place. For me, a thrill in the last days, last couple of weeks have been connecting back with my businesses if they have reopened, to be able to distribute these washable, reusable masks. The other thank you I want to say before, so we don't forget, is Kashmir Valley Bank, and with the help of the health district, allowed us to purchase 25,000 disposable masks that we are also distributing. So our nonprofit organizations can make it and can thrive because of this community. And that's another example of this community stepping up to help. So I'm just great to be here. And my mask is dyed. It's blue jean blue. So same mask, but it takes a dye really well. That's your happy.
Thank you guys. And this was an unintended happy consequence of you guys being in the same building. We are getting to test what it's like to hear you guys with a mask on, and you guys sound great. So
good.
Excellent.
That's wonderful.
Good.
I thought that we would start our discussion kind of with the basics of the disease COVID-19. We've heard so much about it, but when it comes to the impact in our community, how does this virus spread, and what is the life expectancy of the virus on surfaces? So we're thinking about how our customers might come through the door and interact with us. And I think, Dr. Ledgerwood, we're probably going to lean a little bit heavy on you for this question.
Sure, you bet. Well, first of all, what I'm going to present is not fiction, but it is fact, scientifically based. I think it's important to say that. And what I say this afternoon, in fact, may be different in 2 weeks, because the medical and scientific knowledge base about this particular virus actually is changing every week. And our knowledge as to how we treat it and how we deal with it as well is changing. Everybody, if you've even looked at the news recently, you've seen that there's been a significant uptick in the number of viral infections in the United States. We had 35,000 new cases reported in the U.S. yesterday, and that's huge. I've been following Chelan Douglas County Health Department and Okanagan County's Health Department looking at our new cases. And for a time, a week and a half ago, we were really low. But in the last 3 or 4 days, we've had a significant uptick in the number of cases. Yesterday's report from the Health Department, Chelan Douglas County, shows that we had 9 new cases. Now, that doesn't seem like a huge number. But when we talk about this virus and how it spreads, it is a huge number. First of all, when we talk about replication, that is, how does this virus spread itself? First of all, it has to infect someone. It can't replicate by itself, okay? It has to be inhaled by someone. It attaches to receptors in the lungs. It changes their cellular makeup to start making viral particles. And when you get what we call a viral load that's substantial enough, you're infected. Not only are you infected, but then you can start spreading the disease. And all of the openings we're talking about talks about how rapid this spreads is based on what we call the reproduction rate. We would like the reproduction rate of this virus to be at least 1 or less than 1. Any reproduction rate higher than that indicates that it's going to spread logarithmically, And so that's why we need to prevent it. How is it spread? It's spread by droplets. If you cough or sneeze and you don't have a mask on, and you're infected, you're going to spread the virus. So people say, well, that no biggie. We will just keep people that sneeze and cough. We won't let them in our stores. We'll keep them out. We'll make sure if somebody starts coughing, we'll show them the door. Well, unfortunately, anywhere from 16 to 35, 40% of people that have the disease don't have symptoms. In fact, recent data suggests that the average is about 25% that are either without symptoms, the term we use is asymptomatic, or with minimal symptoms like a runny nose or a little sore throat. They will have a viral load that will shed up to 2 to 3 days before they get sick, if they get sick. And so that raises the question, well, how many people out there are actually asymptomatic? And again, it's really a high number. It's a high number. I suspect in our valley, it's probably 30%. That's a pretty good average. Well, who's spreading the disease? Well, if you look at the numbers from our health department, 86%, again, I want to say that again, 86% of the people that have this virus, it's been documented, are under the age of 60. We're always worried about those over the age of 60. The vast majority of that, over 50%, are under the age of 40. So it's this young group that's actually getting documented as having the disease. And the vast majority of the people in that age group don't have symptoms or only have minor symptoms. So how do we prevent that? Well, we wear masks, and we were going to do a big article on mask wearing today, and then the governor beat us to it last night. So masks are terribly important. I've had arguments with people that masks really don't do anything because they don't seal and they don't really block the virus from being shed, but that's absolutely not true. Scientifically proven it's not true. Now, some of the naysayers will suggest that the World Health Organization came out a month or so ago and said, well, it's not important to wear masks. They quickly backtracked on that because when they started looking at the spread with droplet, it was very apparent that the greatest risk for spread is through the respiratory tract and those that are not wearing masks. Again, you wear a mask not to protect yourself. You wear a mask to protect others and those who have what we call comorbid conditions. Unfortunately, if you're age 65, and I fall into that category, and you have one comorbid condition, the likelihood of you having a serious result of this infection is huge. It's huge. In fact, the highest death rate occurs in people over the age of 80 with one or more comorbid conditions. So we really need to do something about preventing to protect our elders in our community. And truly, if we don't do something now with wearing masks, we're also going to find ourselves not getting out of phase 1.5 or whatever we want to call it, but we're going to be in another lockdown. So I hope people really do take this seriously.
Yeah, thank you very much for that. That's interesting information. We know that it changes weekly, and you know the amount of medical information, community information, interaction information that we're having to put together each week to kind of reframe how we go through and work in the community is changing. And I appreciate having people who are able to really deep dive into this. There is then a logistical ramification for those of us in the community when it comes to supporting those orders. Like you said yesterday, it was when we started the conversation at the beginning of the day, it was how can we recommend it? And now we're in the phase of how can we require that? And so Sasha and Linda, I think that there's a lot of businesses out there now looking at an unexpected piece of equipment that they're having to acquire and an unexpected way in which they're going to have to deliver customer service. Can you talk a little bit about some of the resources that our community might have around acquiring masks and maybe some of the best ways that you'd see to having those masks distributed and used within within our various businesses around town?
Yeah, well, Dr. Ledgerwood made a point that I think we're feeling big time in the business community, which is the changing information. You know, our businesses are preparing for certain things and then it changes immediately. Luckily, our two counties have been very proactive with masks and we've been able to distribute so many masks already to our businesses. So hopefully they have at least the starting that they need. Like Linda mentioned in the beginning of this call, we've started even distributing disposable masks for customers when you come into a store, say you forgot your mask, and now our businesses can distribute one to you. For a time period, it was very difficult to find masks. There are local distributors now who people have shifted their business plan. This whole pandemic has really made it so that businesses have to be nimble and quick and change up their business plans. And there are a couple of companies who are doing that now, and we can find masks locally, which is exciting. But yeah, Dr. Ledgerwood, everyone's had to change their strategies quite a bit and at the drop of a hat. Linda, what else?
Well, for a small business, I owned a small business at one time. I certainly don't own one right now, but I talk to a lot of my small businesses. This pandemic has come in waves, right? In March, shut it down. And then as we began to get information on what will be required moving down the road as we go into phases, we as the Downtown Association and the Chamber have really been inundating our small businesses with a boatload of information. Probably too much information. We've erred on the side of over communicating, but loans, grants, these poor small businesses have had to function from no income to modified. Even if they were essential and able to remain open, they've had to adjust their strategies, their marketing. Everything changed for small businesses. So I think what I'm talking about is, how do you communicate with the customer? That honestly, at the heart of these small businesses, everyone I have talked to, their heart has been to do it right. Their heart has been to, how do we function within the guidelines given us to do this right? So for the side of, they don't want to get in trouble for doing it wrong, but the true concern and care that they have for their community and their business. So when you talk about these resources, Mariah, there are a ton of resources out there. There's a ton of information out there. I think what we'd like to help our small businesses do is be a portal for how they get that information to help them. So whether it's the Downtown Association, whether it's the Chamber, we work hand in hand to help these small businesses navigate. And how does this going to look? And how do we help them navigate down the road? So by these disposable masks, let's say someone took a walk on the riverfront and they walked up to downtown or walked into Pybus or walked in somewhere, and they might not have a mask with them. Having these disposables available will allow them entry into the stores or into the coffee shop or into Pybus. So we are doing our best to help distribute, and we are doing our best to help mitigate those issues, because these small businesses have had to, I don't like this word anymore because I have to use it all the time, pivot, right? They've had to change everything. And so I think our goal in today is really being a resource, but being able to be available to help these small businesses survive COVID, because it isn't going anywhere. I think the doctor will verify that. We're here for a while. So in our conversations today, I'd like to throw this out there, is what are the discussions we need to have to help these small businesses prepare for the next 3 to 6 months? Until we get a vaccine, until we begin, how do we navigate within COVID in our community so businesses thrive? Sasha's heard me say this before. We have a health crisis in our city, our state, our nation, and our world. We have an economic crisis as well. Mm-hmm. And we want to be supportive of both.
Mm-hmm. And something I just want to add so quickly, because we can get to it, I think, later when we talk more about the toolkit, but something that Linda mentioned is communicating with your customers as a business owner. And something that within the toolkit is a little checklist that actually does just that. And in this box here, you can put in, now it's required to wear a mask, so I would certainly put that in there, but previously it was optional. But any other things, we have some small businesses downtown that are very physically small also. So maybe they want people to wait to enter until a certain number of people have left, things like that. But I think that that's a really important mass communication tool that you can use as a business owner, to just have that on your front door, on your front window, so that people know your expectations when you walk in. What maybe you have hand sanitizer right as you walk in, and you're asking your customers, in addition to wearing their masks, to please use hand sanitizer before you touch things like that. I think that's a great way to communicate.
Thank you very much. I think in addition to masks, a lot of the questions that we've seen have surrounded around retooling the way in which we sanitize our facility. This is a scary virus that's going around, and we want to make sure that we're doing due diligence as business owners, as community organizations, that when we welcome people in, we're welcoming them into a clean and sanitized facility. So and I think we'll start again with you, Dr. Ledgerwood, and Linda and Sasha, I'd encourage you to jump in any best practices that you've heard. But when it comes to the new way in which we need to sanitize our facilities, you talk anything about to the nature of how that sanitization needs to change now? How often do we need to be cleaning depending on the number of people who are walking through our doors? Are there measures that we can put in place that might have to mitigate a lot of manual cleaning, so we don't have to take on a heavy burden of human resources and new employees to keep up with that, and we could still provide high quality customer service and customer care?
Well, yeah, surely. I'd happy to answer some of those questions. First of all, I think that you have to look at, in any business, you have to look at the greatest risk for exposure. First of all, we know that this virus can live anywhere from 2 hours to 5 days on a surface. And so what you really need to do is then look at those surfaces that where the virus will, if in fact it's transferred from someone's hand or clothing or whatever, to a surface. What surface is at greatest risk to transfer that onto a patient? Actually, it looks like doorknobs are probably the #1 culprit currently, at least in the studies we've looked at. And so if somebody's going to do some cleaning, that's one area that you should do on a regular basis. Now, I know some businesses that have opened down here locally have already, they don't let anybody touch the doors. They have somebody greeting them and they open the door for them and close it. But that still does not prevent people, just because it's been common in human nature to grab a hold of that door handle. So if somebody is coming in or going out of a business, whether or not there's 5 or 6 people in that business, someone should be appointed to do the cleaning on the doorknob or the door sills or whatever on a regular basis, anytime a patient either comes in or goes out of that business. It brings up other questions. So do you, in a business, do you allow restroom facilities to be used in that business? Which brings up a whole different category of cleaning that's going to be necessary. And the current recommendations from the CDC is if someone uses a restroom facility that's not a member of your family, obviously that's going to be the case in business reopenings, then that should be sanitized again with every use. Well, if you start adding up time commitment for that, it can be extensive. So that's going to be a question that individual businesses are going to have to address as to whether or not they're going to allow restroom facilities to be utilized in this reopening. Eventually, probably they all will, but then again, at the same time, it's going to require a substantial cleaning effort as well. As far as businesses in the business themselves, most common places of contact would be keyboards, shelving, particularly any desk that somebody's working on. Wood surfaces are much, the virus lives much longer on a wood surface than it does a plastic or aluminum surface. And so just to say that I'm telling you that you don't need to be concerned because a virus only lives 2 hours on a glass surface doesn't mean that you can take that to the bank. You know, you really need to clean that glass surface on a regular basis. And then it gets to talking about the air you would inhale in a business. And I've pointed this out to several businesses now. How quickly does the air exchange occur in individual businesses? That's very important. What kind of filter system do you have in that building? We are recommending Hepa filters for all businesses, just because even though they will not get all the viral particles and matter out of the air, they will reduce substantially what we would consider to be a heavy viral load. So HEPA filtering and air turnover is very, very important as we consider reopening. And not only in phases 1.5 to 2, but phases 3 and 4 and from here on out until we have a solution to treat this. Remember, we don't have a way to treat this yet. It is out there, it's a bug, and if it gets into some people that have a comorbid or another illness like diabetes or high blood pressure or heart disease, these people could die. You know, the death rate is significantly higher in that instance. So even though it's going to cost time and money to do some of these things, I think most businesses would appreciate the fact that they don't want to have any one of their regular customers getting sick within their establishment and then being hospitalized with the potential of dying.
I think you have to look too at industry sectors. The guidelines that have been put out, for instance, salons have different guidelines that help them with this question of sanitation. What I have seen, actually, I'll address 2 things. I have seen businesses change their procedures. They have hand sanitizers at the door. Many of them are leaving their doors open. And we are going in the summer, and yes, it was almost 100 degrees yesterday, but we have cheap power here. And we as an association asked the city, who approved what they call the private use of public space. So we are allowing our businesses and restaurants to go out onto the sidewalk and expand their business out to help with this problem of sanitation. The other thing is, I think what we have to take into consideration if you own a business is our customers have changed their habits. Just like businesses have had to change their habits, our customers are changing their habits. So the beauty of a small business is they know their customer. So that communication of what are you comfortable with? What can we do to help you be more comfortable will be critical and vital as we move into especially the fourth quarter, which we're all counting on to help us make it through the year. It's our harvest in retail.
Mhm.
Yeah. Thank you very much, guys. I know at the museum we've been wrestling with that question as well. Do we change the number of days that we're open? Do we change the hours that we're open? How can we help expand maybe our access to the community so there's fewer people in the building at a time? I've also appreciated seeing out in the community times that have been set up for those who are more vulnerable to come and to shop and to engage. And we're all making modifications to help keep everybody healthy. And it really does take a community effort to do that. One of the, some of the other questions that have come up when it comes to not only keeping our customers healthy, but is also keeping our staff healthy and making sure that that staff who is interacting with each other and interacting with the community has the best chance of staying healthy. And I wanted to ask your guys's, let you guys take a lead in the discussion on screening employees before work. What are some best practices that you've seen? Dr. Ledgerwood, what are some policies that you recommend putting in place when it comes to making sure that that a healthy staff, a healthy workplace environment is being maintained?
Yes. Well, first of all, there are some businesses that have already instituted temperature checks on all employees when they come in every morning. And I don't know of anybody locally, but some of the groups that I have read about regionally and nationally are actually doing testing on a regular basis to their employees to make sure they're not a carrier or asymptomatic carrier. I'm not sure that's necessary at this point in time, but it might be in the future. Again, I think that people that work for you as a small business owner, you certainly have to have some trust with them, and they in turn have to have trust in you. And so anybody with any kind of a respiratory infection and or history of fever in the preceding 24 hours should not be coming to work, again, unless they can go in and get tested for COVID. Now, the problem with getting tested is that the turnaround time is still about 72 hours. We don't have a rapid turnaround test that is reliable, even though nationally our president suggested that the one from Abbott Laboratories would give you answers within minutes. It turns out that the specificity, that is how often a true positive is only about 80%. Well, that's not good enough. We need to have a test that's reliable 95 to 90% of the time. And so until such test is available and readily available, I wouldn't recommend doing testing on employees unless they have a respiratory type of infection of any kind. And then it may be worthwhile sending them to one of our local test centers to get tested to make sure that they're not a carrier. Again, remember 25%, at least 25% of people that have COVID don't have symptoms or only have mild symptoms.
Yeah, I think employers need to be really careful with this, and there's a lot of really good information. So if you are a business owner or manager thinking about, wanting to do symptom checks or other things, we had the pleasure of hosting an event with JDSA Law, and one of their lawyers went through kind of employment law and privacy and all of that, and we have those slides on our COVID-19 resource page, and I would encourage people to look back through those and email the chamber if you have any questions. We're happy to direct you, because there are a lot of privacy laws and things like that. I used to work for Confluence Health, so I have some understanding of medical privacy and HIPAA and all of that. And one of our colleagues here at the chamber and I were talking, and we realized probably a lot of businesses, she also used to work in healthcare, a lot of businesses may not have the background that we do, understanding HIPAA violations and things like that. And suddenly, we're talking about temperature checks and all of these things that are personal medical privacy. So if you are going to do temperature checks on your employees and keep a log, I know that's something that some people have done. I come in a morning, you take my temperature and you write it down and keep a log. Make sure you're keeping that log somewhere private in a manager's office or things like that, because that is technically medical privacy. And people, there's a lot of, I'm not an expert at this, so I don't want to be giving, formal advice, but I would definitely encourage everybody to take a look at some of those slides that JDSA Law put together for us so that you understand as an employer what your employees' rights are around health, what your rights are, and those of us who have the privilege of being able to work from home, like those of us on the chamber staff, if I don't feel well, it's my responsibility to make sure that I either stay home because I'm sick and I need to stay in bed, or stay home because I'm not really sure what that bug is and I'll work from home. And if you can't do that, a lot of Linda's businesses may not be able to do that. You have to open your shop to sell your clothes. But, as you can, encouraging those stay home policies. But yeah, again, our COVID-19 page, if you just go to Wenatchee.org, there's a button that says COVID-19. There's loads of resources there and a lot to speak on that.
Mariah, it just occurred to me, when you opened a business, the entrepreneurs are passionate, whether it's a restaurant, a salon, a retail business, you're passionate about what you're doing. I don't think they ever thought they'd have to be a medical expert, a cleansing expert. I just have to applaud our small businesses that have navigated this, those who have been open. I just want to applaud them for their tenacity to keep doing this. Thankfully, we haven't lost a lot of business yet. And these small businesses have had to navigate some pretty difficult times. So if you have a chance, and this is, I'm going to say it one time or the other, to stay local, be local, it's now. These small business owners, and thank them when you go in, and maybe you don't buy anything, but thank them for what they've had to go through in the last few months and will go through in the months ahead to stay open. It's pretty amazing. When you were talking about HIPAA laws, I'm going, oh my gosh, how do you do all of this? And in a small business, those employees are your family. They're your family. Some of them are your family, right? They're your family.
Right.
And they may be the only breadwinner in the family when an employee coming in. And so, the economic hardships that this whole new normal has created is huge. And I appreciate people with a little sniffle saying, well, it's just my hay fever, it's just my allergy coming in. Getting back to the HIPAA, the laws about patient privacy and stuff, again, that's been looked at substantially in the medical profession as well. And new normal laws will be coming out of that to protect people, like employers checking temperatures and the like. And you better believe it right now that there's written word on airline tickets, and also when you enter an airline or a SeaTac or other place that suggests that if you're sick and somebody sees you, you're not going to be allowed to stay in the building. So who knows? Again, as I say, the transition that we're seeing is changing day to day, and what will happen. I just harken back to what we thought about King County and I-5 corridor and the number of infections that they had, and it said that, well, that's never going to get here. We're not going to have to worry, that there's just, we're outdoor people. We don't get exposed to these things. And then I start looking at what's happening in the Tri-Cities, and more importantly, what's happening in the Yakima Valley. And I say, well, unfortunately, there isn't any kind of cage that keeps this virus from impacting everyone. So again, what's normal today may not be normal tomorrow.
Right. Yeah. And Linda, I appreciate your statement too about all of the new acquired knowledge that anybody in a leadership position in an organization or business has had to take in. I had a question, to follow up all of that. As a business owner, you've done your best to make sure that customers and staff are wearing masks. You've developed a culture of wellness and of health, encouraging people to stay home that are sick. You've instituted facility sanitization, but shoot, you still have somebody on your staff or one of your customers that has come down with COVID. I would assume the next step after that would be to close your facility, make sure that there is a full sanitization, and then reopen. In the event that you do find that somebody who either is on your staff or regular customer has come down, what are your guys' recommendations that the steps that a business should go through to kind of do that, their own personal restart to make sure that they're opening back up in a safe manner?
That's a great question, and I kind of want to glean back a little bit to the toolkit that we've released. In that is a business safety plan and a business safety worksheet, and I would highly encourage, this is something that we did here at the Chamber, for businesses to think exactly about your question, Mariah, and come up with, I call it a phone tree, but come up with a little plan. I wrote this out for our team, and our team's been briefed. Everyone signed off that they read this plan, and I think that's also very key, is what's the use of a plan if nobody knows what the plan is, right? So here at the Chamber, say I have been, it's Wednesday, I've been working in the office since Monday. Turns out I am asymptomatic carrier. I got tested because my mom works at the hospital, and so I had to go get tested also. And I come back positive. My first thing is not to come back to the office. It's written there. And I am to call my direct supervisor. My direct supervisor then needs to notify everybody else. She doesn't need to, if it's my personal preference, that I have a very small team here at the Chamber. We're like family, like Linda mentioned. I don't personally care if my coworkers know that I'm COVID positive, but maybe you work at a larger company and you don't want people to know that. That's, again, personal privacy. But the rest of the staff should be notified that there has been an infection in the team. They don't need to say who and all of that. And then we would close the Chamber down, and we would contract out with someone to do deep cleaning, and make sure that everything is cleaned really well, keep the storefront closed, and keep people working from home for about 48 hours, and then come back in. And I would not come back to work until medically I was cleared to come back. That can be different for different industries, I think. I don't want to speak for everybody, but that is an example. That's what the Chamber has done. And in the toolkit, it kind of walks you through making a plan like that. And then you can just fill in what makes sense for your team. And maybe it's a big company where only a section needs to be cleaned. However that works. Like Linda said, there's so much of this that is so specific to each industry. So it's hard to give blanket recommendations, but for a small business the size of ours, a business that could work from home, that's what we're planning on doing here at the Chamber, if that's helpful to anybody.
Sounds great. Yeah, thank you. That is. And for those of you that are on Zoom, I think that we have posted the link to that toolkit in the chat bar. We'll also make that available afterwards. I could see one of the difficult things about implementing that plan. Like you said, you put a plan together, hopefully everybody knows of it. But there is a stigma that is around COVID-19 and having COVID-19 and letting the community know that your business has been impacted by that. Do you have any suggestions on how to address the social stigma that may be associated with COVID-19 transmission and prevention?
Well, I guess I go back to any business owner or a business takes on a personality, right? Whether it's a service, a restaurant, whether it's a retail, their customers, the owner knows their customers, and their customers know their owners. And in this community, what makes it beautiful is we're family here. We saw that in the weeks of shutdown, how the gift card campaigns, this community always rises. This will be the same. How you market your business through this will be important and critical. And so how you market issues, I did notice a business who, and it wasn't in this area, but I did notice, and they announced that one of their employees had tested positive, and here is what they've done. They shut down, they cleaned, they reopened. They're moving forward the very best they can, doing the very best they can with what they have. So I think it goes back to doing everything you can do within your power to take care of your employees and your customers and run your business. And I think it's individual, Mariah, business to business. I really do. And I think that how you market, it is really important how you market in the weeks and the months ahead. To what do you want people to know that you're doing, that you're gonna do, and that you want them to do. And I think if you're really blunt level honest, people appreciate that. I really do. You know what, I don't have an easy answer. There is a stigma, but there is also something valuable about honesty and openness.
Yeah, and I think the community has a really big role to play in this as well, and doing our part as just individuals in the community, not just business leaders or employees, around that, and saying, you know, it's okay to continue to support businesses who, you know, are doing the right thing by taking care of their employees and letting them go home and closing down the business, and trying to combat that stigma as a community as a whole. You know, we're all in this together, and this is a scary time, whether you're, you know, at home because you have conditions or underlying conditions that you can't. I have good friends who have small children who it would be devastating if their child got this. And so they've stayed home, and they've chosen not to patron businesses. They've chosen not to go to grocery stores. They're finding other ways of doing this. So I understand there's a lot of fear, and we have to work through this as a community, but this impacts all of us in different waves. I think I saw a quote somewhere about that, you know, we're all in the same storm, but how you feel that storm is different, you know, depending on what boat you're in or whatever. So just being mindful and doing what we can as business leaders and employees, and you know, and working with our friend groups and combating that stigma that you talk about. But I'm encouraged by all of the things that both of our memberships are doing to keep people safe, and I hope for all of them that they can avoid this situation that you're talking about, and it's not something that they have to cross.
I just like to throw in something. Sorry about the noise. My neighbor orchardist was moving trailers. I think that contact tracing has been getting a lot of gas lately, and both positive and negative. And certainly regional health and national health departments are really pushing for contact tracing in a positive case, where that may impact this so-called HIPAA violations or HIPAA laws in some ways. But truly, at least the national leaders and thought leaders are suggesting that the way this is ever going to get under control before we get a vaccine or some definitive therapy is that we're going to have to use contact tracing as a means of having people that have been exposed to an active case and quarantine them. So obviously there's a lot of pros and cons, and I've read some really negative things about that and constitutional rights and everything else. But the fact is that that's probably going to happen at some point in the next 6 months.
Thank you very much. Yeah, I'm hearing that you know, the business community is its own community. It's a part of this larger community. There's a lot of information that's going on there, some out there. Some of it is valuable, some of it is misinformation, but strong communication from your own business, from your own organization, about what you're doing, about handling your things is really going to keep that trust that really builds community and will cement you as a part of the community is going to be an important component to all of this, that we can't control the direction that this virus is going to take. We can't control guidelines that come from on high, but we can control what we're telling our customers, our employees, and the community that's being built around that. Speaking of those guidelines, I think as somebody who has been trying to follow them for my own organization, it's heavy reading material. There's a lot to try and understand. There's a lot to try and disseminate and make sure that we're doing right. Do you, is there a good way to stay up to date on local public health guidelines, local public health experts, that does remove some of the burden from all of us out here of trying to become local public health experts?
I'd say the best way is to bookmark the governor's specific website that has all of the guidelines. I am constantly checking that and pulling those links into our COVID-19 page. but I'm only human, and there are times that I, on Wednesday, it's Wednesday now, I'm sorry, see, going crazy. On Friday, for example, there were new wedding guidelines that were released. I think I still need to put those up on our COVID page, I'll be honest with you. So that governor's website, and I believe I have a link to that on our website as well. They list phase 1, phase 2, phase 3, and then all the different industries, and they populate that constantly. So I have that bookmarked on my desktop, checking that regularly, and just knowing your industry. And a lot of folks are a part of associations, the Restaurant Association, the Retail Association, and they're getting information from that. But I do think, keeping an eye on those things. We're trying to consolidate that information at the Chamber and Downtown Association. I send out a weekly COVID email. Like Linda, I believe, referenced at the very beginning of this call, there's so much information and it's constantly being thrown at you. So we understand that it's a lot to navigate, but trying to pare that down for business leaders and nonprofit leaders so that you can understand that. But I think once as a restaurant owner, for example, you see your phase 1 guidelines, and then now you know where to go for your phase 2 guideline. You'll know where to look now that we're getting kind of into the swing of things. I think it'll become I hope a little easier. As for local guidelines, it's more about knowing where we're at in the process and then going back to the state, because the state is still controlling and putting out that information. We're not doing anything necessarily different than what the state is saying. So you don't need to worry about navigating the 2 different ones. It's just a matter of knowing that, okay, right now in Chelan and Douglas County, we're in phase 1 point, whatever you want to call it, and knowing what that means. When we go to phase 2, then you know where to look in the governor's website.
And I think just breaking down those barriers, ask us. My organization, I'm here to support you. I don't know what you don't know. So if you have a question, I may not answer it. I know who to send you that can answer it. So to be able to utilize the organizations that are here to help you. The other suggestion I have is kind of silly, but this would be a good time to have a partner business. So a business, if you're another retailer that you communicate with, that you talk together. We get siloed a lot of times when you're a small business owner. Have so much to do, it's hard to reach out, but this might be a really good time to have a partner business that you can talk to, bounce off of, because there's a lot of misinformation out there, as well as a lot of good information. So I recommend to my retailers, find a retail buddy or find a restaurant buddy or find someone that you trust that you can bounce off to, because sometimes you don't want to ask a stupid question, even though it's really no such thing. So utilize each other. That's what we do here. That's what makes this place special. We support each other. Give people an opportunity to support you and you support them. So maybe reach out to somebody and say, okay, I'm a little confused about this, or what are you doing about that? People really want to help each other. We just don't know how right now.
And please use social media to find information. That both of our organizations put out information on social media, but please don't get your news from social media in terms of non-credited source. We provide links, for example, on Facebook and Instagram so that you know where to go. But getting your news or your information directly from the governor, directly from the CDC, directly from the local health district, you could use social media to find those links, of course. But if somebody just, plain text something, please consult. And like Linda said, ask us. You're welcome, whether you're a member or not. The Chamber is here, and so is the Downtown Association, but I'll speak for the Chamber. The Chamber is here for all employees and businesses, whether you're a member or not. That's really important to us. We have an info@wenatchee.org account where you can just look us up and call us. We're happy to help you in any way, shape, or form.
Thank you. Yeah, I want to deep dive into some of those resources that you guys have been talking about. Sasha, you mentioned the Toolkit a couple of times. I want to give you some time to talk about that. And Dr. Ledgerwood, I know that you have a lot of great resources that you've been using to support businesses. And if there's anything that you would like to bring up at this point in time and talk over a little bit more, I'd love to hear from you guys on that.
Yeah, so the Chamber convened what we're calling a recovery council, which Linda participates in. That recovery council is chaired by the two mayors and is made up of business and community leaders. And what when we started meeting, they really wanted to find ways to remove barriers for our business community and our community at large. But a lot of these folks are in the business community, so thinking there first. And one of the ways that we saw we could do that was by putting together, actually first, I believe you guys thought of the checklist that we talked about earlier, and then it kind of morphed into a toolkit. So again, this is in the toolkit. It's on page 16 to be exact, but the toolkit, like you had mentioned, Mariah, there's just so much information out there. What we decided was, let's get the most critical information that no matter what type of industry you're in would be helpful to you. So there is general information on what COVID is, similar to what Dr. Ledgerwood was talking about. This is the basics of COVID. And then there are guidelines from the state for both individuals and businesses that are just generic guidelines that are helpful in any case. And then there is a business plan example that you can just kind of adopt. And there's also a worksheet. And then in there, we have lots of printouts. I think there's 9 printouts of helpful posters you can put in your business, a stop that there's max capacity, things like that that can help you keep people socially distanced, keep people safe. So we realized that need for, we were getting a lot of questions. I don't know where to look for this, or I'm confused about that. And so hopefully the goal is that this is a one-stop shop for you to look up. Of course, like Dr. Ledgerwood said, things are changing weekly, hourly, daily. I hope the toolkit doesn't go out of date in that it's just generic guidance that everyone can use and should sustain. Something that has already become outdated in the resource, for example, is masks. We talk about encouraging masks in that resource. Of course, masks now are required, but the sentiment is the same. I mean, we were hoping people, even back then when we put this out, we put this out like 3 weeks ago. We were encouraging folks then to use masks, and we're encouraging folks now. But so that is found just straight on our main website. It's also on the COVID site that is in the chat box, but it's right there. When you open Wenatchee.org, it says toolkit. It's also in Spanish, which we're really grateful to have had access to translation. Thank you to Our Valley, Our Future, had that translated for us so that we could distribute that to our friends in the Spanish-speaking community. And we made sure to get that out to folks who may not be chamber members, along with the masks, in partnership with Our Valley, Our Future, and a couple other folks who are really key in distributing printed copies of that and masks so that our friends in that community can have access to that information. That's something that's been a big discrepancy, since the beginning of the pandemic, is making sure that things are translated into other languages so that everyone is privy to that information that's changing so quickly.
And really quickly, before the doctor chimes in, I just want to applaud Sasha and the chamber, but they pulled information from other counties, good information, and then this was a collaborative with the Chelan Chamber, Leavenworth Chamber, and our chamber. We want regionally to have a consistent message, which is really important. I think that the same message you're going to hear in this region if you go out of Wenatchee.
Yes, thank you, Linda. That's huge. These are all statewide guidelines, so no matter where you go, you should do it. So we were really grateful for those other communities to be on board with this.
Okay, so there's a lot of reference sources out there that are intended for the public. Actually, a good resource that is written in lay terms, public term, people can understand it, is WebMD. A wonderful resource. Particularly, they've really expanded their source of factual medical information for people. And if you have access to the internet, that's an excellent source. The National Institutes of Health and Dr. Fauci, wonderful resource as well if you really want to get factual material. I really would encourage people not to read social media and listen to all of these out of left field theories about COVID-19. There was one circulating yesterday about if you had a viral illness or some illness that was influenza negative in December and lasted for more than 10 days, you probably had COVID-19. Gosh, you know, it's that kind of information that's being spread that actually does a disservice to all of those who are trying to educate people to make sure that they're not getting the disease and preventing the disease. A couple of the things about mask wearing that I think is important to understand. I've heard many comments about people that wearing masks if they have some kind of respiratory problem as a chronic condition, that it's dangerous for your health. Well, in fact, it is not. You cannot get CO2 poisoning from wearing a mask. People that have COPD, chronic obstructive pulmonary disease, emphysema, chronic bronchitis, you cannot make your disease worse wearing a mask. And so again, if you're getting your information on Facebook or Instagram or other social media outlets, make sure it's factual, because most of it is not. And it's led to all kinds of theories about this disease being a political portion of our communities. It is not. It's real. I earlier mentioned about polio and those of us in our age group that experienced the fear of polio. And I think for those listening in that did not live during that time period, this is as much of a concern or more than polio was then. So until we get something that we can treat this disease with, hopefully by the first of the year, a vaccine that's effective, we need to be very, very careful. Again, it would be a terrible situation for anyone in business and or at home that would have this disease and give it to one of our elders, grandmother, grandfather, and have them die from the disease.
Yeah, thank you. We're coming to a close on our time here, but I want to give you each a chance to say goodbye to everybody and to give a call to action. You know, this was a business forum. It was as much informational as it was hopefully giving people a ability to go out and do something and make sure that they're feeling that they're doing things in a safe and healthy manner. So if there's any parting words or last couple of calls to action, 3 steps people can take right away to make sure that they're reopening safely, I'd like to turn the floor over to you guys one last time.
Well, I'll start with a request that if you have a question or need help to ask, please try. We've been very siloed in this to take care of our business, our family, our friends. This is a good opportunity to reach out to other businesses, other families, other friends, however you can do that within the confines of this to do that. I think what this community needs right now, as well as all other communities, but I really care about this one, we need a dose of hope. And so the hope is for us is that people really need to be encouraged right now. These businesses know that you care and that you miss them. And if you are a business owner, this community embraces you. So my dose of hope today is just, we have a chance to do a lot of things. Just be kind. And we have to smile through our eyes now because we're covered up. But just we need that kindness and that hope now more than ever. And that's pretty simple thing to do. But you know, in the grocery store, you know, just thank the people who have been consistent in helping us navigate this. Everybody's stressed right now, and the little things we can do to eliminate that, that's my hope. That's kind of simple, but that's my hope.
Yeah, I think for me, I heard this somewhere else, and I apologize that I can't tell you the source, but I love it, and I'm just starting to try to say this in my mantra. It's the 3 W's. Wear, wash, and wait. Please wear your mask, wash your hands often, and wait, meaning give people space, give them that 6 feet. If you're in the grocery store and somebody's taking something off the shelf, don't encroach in their personal space. Please give them 6 feet and wait until they're done. Or if you're coming to one of Linda's small businesses downtown and it's crowded, please wait outside until you can go in out of respect for others. But most importantly, please wear a mask. It's very helpful. You've heard from the doctor, but also we really, really hope it'll keep us open. Mask up to open up, as we're saying around here. Our businesses need your support, and the easiest way you can do that is by staying healthy and keeping all of us healthy. So please wear your mask, and you can diet like Linda's. So it's a fashion statement. Mine is a super boring fashion statement today, but it's fashion statements. Everybody get excited.
I would just end with saying complacency is our worst enemy, and that there is a new normal and it continues to evolve. We have no idea what it'll look like in another week or another year, but we can do it. And I love the comment about being nice to people. I think that's terribly important. This is something that most of us have never experienced in our lifetimes, and making sure that we stay happy inside, and we'll get through this.
Yeah, thank you all so much. What a really interesting and robust conversation. I feel like I've been in the mix of trying to figure out reopening for the last couple of months, and I was certainly jotting some stuff down for myself of what I'm going to institute here at the museum. We're eager to open up. We miss seeing the community in our doors, but I want to thank Linda, Sasha, and Dr. Ledgerwood. Thank you so much for joining us today. This was invaluable information, and I hope that all of you out there, I want to thank you for taking your lunch hour to join us. And I'm hoping that you were able to find some guidance, a little bit of knowledge, a call to action, something that you can go and do, or even just a sense of community that we're all here trying to figure this all out together. We can't wait to be back all together, but we hope to do that in a safe manner so we could stay open. This Q&A was recorded today, so if you, for anybody who missed the live show, we are going to be posting this on YouTube. We'll be sharing this with other organizations who can share this around as well, and it will be on our Facebook page. We'll also be posting any of the resources that were mentioned throughout. There was questions I think we didn't get to that we'll try and get an answer to, and resources that the Chamber and Downtown Association Dr. Ledgerwood mentioned, and we'll be putting those up on our blog. So please visit us at WenatcheeValleyMuseum.org. And you could check out our blog and you'll see all of that information there, including the redirect to the Chamber's Toolkit. And I would like to invite all of you back, both on the panel and those that were out listening, to our next community forum session. We're going to be holding another one, a public health discussion with some of our public health leaders on July 1st. So a little bit more on this topic, and hopefully we're all learning a little bit more along the way. But until then, thank you for joining us, and all of us here at the Wenatchee Valley Museum and Cultural Center. We hope you all stay healthy, stay safe, and we hope to see you soon.
Thank you, Mariah.